Macular degeneration is very common nowadays. And the ARMD means age-related macular degeneration. That means macular degeneration which forms as a part of senility in senile patients. So here we have to consider two things. One is the pathology of the disease, second is the senility of the patient. When these two are combined together, the disease comes into the picture, ARMD. Anyway, it is a degeneration of the macula of the eye. Macula is the most sensitive part of the eyeball, which lies in the inner layer of the eyeball. It is retina. So macula is the most sensitive point of the retina. And when degeneration happens to this area, the compulsory symptom is visual disturbances, because this is the point, macula is the point where the light rays are getting converged. Light rays means light rays reflected from the object and comes to the eyeball and travels through the eyeball through the refractive media and finally converges on the retina, especially on this macula. So if this macula is defective or diseased, this convergence will not give that much effect because after converging the light rays, a series of reactions takes place. First is photochemical, then electrical, then nervous, like that. And the final product is a nerve impulse. And this nerve impulse is carried through the optic nerve, which is starting from the retina, and it reaches the brain stem through optic pathways, and in the brain stem, especially in the cortex, the visual cortex, particular point, there this impulse is converted to the visual sense. So everything happens by convergence of the light rays on the macula. Here comes the severity of this disease. And in general, the senility is prone to diseases. And if their retina, especially macular area, is already weak or sensitive or delicate, then probability of developing this macular degeneration is more. So his eye strain is more, or is more using these some factors which are not suiting for the betterment of eye. In such conditions, this senility will be developed on the macula. Then macular ARMD is developed. In senility, there will be some general eye problems that is related to the vision. There will be some blurring of vision, or sometimes difficulty in reading, that is presbyopia, or sometimes some changes related to cataract. Like that, some visual problems will be there. Just like in any other part of the body, here also comes some changes. But particularly in ARMD, some characteristic additional symptoms will be there. That is mainly the central field will be lost. That is, when a patient looks at a particular area or a object, that central field will be lost. There will be dark area in that central field. That is very particular. And other than that, when the situation becomes little more chronic, there will be other pockets where vision will be missing areas we can say. That is another important symptom. Then another symptom is distortion in the vision objects. That is, the objects will be, the shape will be distorted. For example, if there is a straight line, the patient will be seeing it as a wavy like or zigzag in nature. It may be both in vertical or in horizontal views. So distorted vision is a very important thing. And then comes some difficulty in the color sense. because macula is the area responsible for sharp vision. Sharp vision includes the shape, size, and the color, etc. So when macula is affected, these features, these particular properties will be lost. So the patient may not be able to get the sharp difference in the colors. That is one symptom. Then comes these objects may be small in size in very chronic condition. If it is a big size, it will be seems to be little more smaller. Sometimes there will be a difference in this distance also. That in such a condition, the patient will be he will be feeling much difficulty, especially while stepping down the stair, because the step will not be in the position he is supposed to be. So he will be unable to walk freely. Always wants to some support, or in a the level will be a little different. Small ups and downs may not be freely accessible for them. So that also makes a practical problems. So these are the main symptoms that face by a ARMD patient. And sometimes what happens, they will be their professional life or practical life also will be affected. He is highly intelligent or able to see the things, but not in a perfect way. Zigzag in nature or distorted way, or some areas are missing. That becomes very difficult for them. Sometimes there is one more important feature. There will be missing letters while reading a sentence. There will be some letters will be missing. That means, for example, the TH, the means H will be missing. So he will be saying only TE, and he has to shift his eyes. That also makes much difficulty for them. So practically it is a very serious thing. You may not be able to go with this smooth life. While considering the function of the eye, we know all three factors are important equally: Vata, Pitta and Kapha. But the area of macula is more concerned with the Pitta. Because simply we can say lightrays are converging on this point, so itself Pitta is the most important factor. So any vitiation of Pitta, especially those factors which will vitiate the macular area or the sensitive area of the eye, that will be a causative factor for the development of macular degeneration, especially ARMD. So we have to consider two types of Pitta here. One is Pitta is of two different types of Pitta. 5 Pittas are there, and among that Alojik Pitta is concerned with the eye, and in the eye itself there are two fractions for Alojik Pitta. One is Chakshur Vaisheshika Alojik Pitta, which is located inside the eyeball. Second is Buddhi Vaisheshika Alojik Pitta, which is located in the visual cortex of the brainstem. So when in ARMD, this Alojik Pitta is vitiated. Both Alojik Pitta are vitiated generally. In the macula, it is the Chakshur Vaisheshika Alojik Pitta, but vision will not be formed in the eyeball. It is the sense of vision is developed only in the visual cortex. So Buddhi Vaisheshika Alojik Pitta also comes into the picture. So by all means, we have to consider Pitta as the main factor. But even though Pitta is the acting principle, Vata is the activating principle. So Pitta can work only if Vata permits to act. That means Vata is the controlling factor or the activating factor, like that. That is Ayurvedic theory. So we have to, in the treatment realm, we have to consider equally these both things, both factors, Vata and Pitta. That is the thing. So for the maintenance of Pitta, of the Alojik Pitta fraction, we have to do treatment in the locally in the eye itself. And for the maintenance of Buddhirvaishesha Alijagupitta, we have to do treatments on the head region. And the Vada concerned with this particular disease is Pranavayu. That also is located in the head region. So we can conclude that for the treatment of macular degeneration, we have to do treatment both ophthalmic in the eye and also on the head region. One is for the control of Alochika Pitta, and the other is for the control of Pranavayu and Buddhirvaishesha Alochika Pitta. A combined action of all this treatment gives the result. Already we have seen that it is a senile change, but those people who are using their eyes more, they are more prone to the disease of that particular organ. So, people who are working a lot, working means not physically, but with their brain and their eye, because these 2 points are having the involvement of Pitta. So, this type of degenerative changes will be easily affecting them. That is the one social relevance. They will be reading a lot or thinking a lot. So, once they are unable to do all these things, they will be stressed or mentally upset and confused also. So, they will be taking so many steps to get rid of this. In that way, this is a very high level social relevance. So, it is our responsibility, not only doctors, but people also, to avoid the development of macular degeneration in their senile age. So, they have to anticipate there is a chance to happen this. Then they will take care of that. For that, to protection of the eye, to prevent eye disease is very, very important. There are methods in Ayurveda to solve this problem. Anyway, there will be so many diseases in senile periods. It may affect any organ which they are using most. There are arthritis type of changes, or this hypoxia type changes, or cardiac or heart related and eye related, like that, or ear related, deafness, like that it goes. So we can anticipate, we can see that there is chances of developing some diseases in my eye in senility. That is that's a fact. So those who are using their eyes for their professional life or for their existing, they have to think of the precautionary methods to avoid such a stage. For that, there are methods in Ayurveda, both ophthalmic applications and also external applications other than eye, and also oral medications. To prevent the vitiation of Pitta is the most important factor. A usage of a very suitable oil for head, for daily head massage, that is very good for the prevention of ARMD. And anjanas. Anjana means application of collyrian-like the paste-like medicines in the eye as a daily practice. That also seems to be very important and highly effective in the prevention of macular degeneration in the senility. And the oral medications, there are so many things that can be used regularly, but the choice, the selection should be according to the body constitution and the dosha prakriti of that particular person, and also the age of the patient. So it varies. There is different materials, just like Jeevanti or these grapes or Shadavari or that Amla, very common. These are effective in the preventive level, but the selection is very important. One thing may not be suitable for the another person. So the choice should be by an expert hand only. We have already seen that there are two types of ARMD mainly. So itself the treatment also varies into two groups. If we are taking one group, that is Vata predominant or dry type, the treatment is accordingly planned. In the other session, that is Pitta dominant ARMD, that is wet ARMD, the treatment is having another protocol. For Vata, it is very simple. For Vata dominant condition, it will be Vata Shamana in general. Vata Shamana means there are lakhs of Vata Shamana type of treatments, but it should be beneficial for eye, especially for macula. That is important. And here we have to consider one more thing. Vata is not inside the eye, it is in the head only. So while handling a degenerative condition in which Vata is a dominant factor and the main functioning or the vitiated factor is Pitta, then we have to consider both Vata and Pitta with equal importance. That is the peculiarity of the Vata predominant macular degeneration or Vataja ARMD, I will say. So there are treatments on the head region and also in the eye. For Vata Shamana or Vata vitiation, oil comes into the picture. Different types of usage of oil medicated with suitable drugs. There are so many drugs which are highly effective in the for the control of degenerative conditions. That type of medicines are to be used for medicating the oil, and it is used for various purposes. For the eye treatment, for the ophthalmic application, we have to consider Pitta. So drugs used will be having some Pitta Shamana properties. And for Pitta Shamana property, the main base will be not this oil but ghee. So drugs which are suitable for the control of Pitta in the eye, that should be medicated with the ghee preparations, and it is used for very special type of treatment procedures. And Indian medicines also are charted out accordingly. Vata Shamana and Vata Pitta Shamana, oral medicines are enough and more for its control. And for the treatment of other group, that is wet ARMD, the treatment protocol is entirely different. Oil cannot be used at all. Here there is leakages and it is wet in nature. So Pitta Shamana and Aropana will be the treatment line of treatment. For that, treatment on the head region is absolutely necessary but not Thailam. So various procedures such as Chirolebanam, Chirodhara, etc. are there without oil. And the same way, there are various preparations for medicines for ophthalmic application other than ghee or oil. A combined usage of these things will give very good results. We have already seen that it is a senile change. That itself means it is there with the person. Senility cannot be cured. That is a fact. But disease associated with the senility can be controlled. It is treatable, it is manageable. But it is not curable. That is the fact. But there are so many factors, dietary and other habitual factors, by which we can manage it without danger, without being progressive in nature. And after a perfect treatment, vision can be improved. Vision is improved to a great extent. And for the maintenance of that success, that result, we have to follow some restrictions and some other simple medications. That is the fact. We have seen that ARMD is a condition where visual defect is the main symptom. So if it is progressing, the visual defect will be also progressing, and vision loss is the main factor. And that means if not treated in time by an expert with a good medicine, there is a chance of being blind. So if you are treating it in a correct way, I am saying about Ayurveda only, in a correct way with appropriate medicines, we can avoid being blind and maintain a good life with a good vision.